start our introduction uh, and brief bio. So, Assalamu alaikum, everyone. Good morning, good afternoon, good evening, depending on where you're joining from. And it's my pleasure to welcome you all to yet another in the series of the APPNA Pakistan Clinical Research Landscape webinar. So, the APPNA is the Association of Pakistani Physicians of North America, and we are working under the Medical Education Research International Training and Transfer of Technology, or the acronym is MERIT Subcommittee of APPNA. My name is Sarfraz Hasni. I'm the moderator for this session, and I am a adult rheumatologist and clinical research based at National Institutes of Health in Bethesda, Maryland. And we have our panelist, Dr. Saeed Uzair, Dr. Umar Hayat, and Dr. Mohammad Akhtar Hamid is here. And we are happy to be joined by two of our presenters today who are going to talk about the artificial intelligence to improve healthcare delivery, a use case. The presentation will be mainly done by ASLAM HASAN, who's the CEO of MedsightAI. And I just would like to add a disclaimer that these webinars are done as a part of increasing the conversation and also to enhance the technology transfer and make people aware of the clinical research landscape in Pakistan and make connections between the international community of Pakistanis and those who are living in Pakistan. But by no way it means any endorsement of any product or any commercial entity. So this is just a disclaimer from the APPNA MERIT side. So with that, Aslam Hassan is the CEO of MedsightAI. He's a dynamic tech leader and CEO of MI, where he spearheads the development of AI-driven solutions for electronic health records. He has over 20 years of experience in technology. He has served in various capacities in multiple industry giants like Ericsson, AT&T, and Oracle. He has excelled in roles spanning product management, sales, and business development. He has an MBA from the University of Washington, and he has understanding of good understanding of healthcare landscape, enriched by some family connection in the field, driven by his commitment to advanced healthcare technology. And at this webinar, he will be exploring the informative impact of AI in healthcare. And joining him also from MedsightAI is Mr. Rashid Qureshi, who is the founder and CTO. He's an entrepreneur for over 25 years experience in tech industry. And he is the founder and CTO, which I'm assuming is Chief Technology Officer of MedsightAI. He leverages artificial intelligence to enhance workflow management in healthcare, improving operational efficiencies and patient outcome. He has an extensive background in developing large-scale enterprise and consumer systems and key product launching at Microsoft and Azure and 365 ecosystems. So we are very fortunate to have these two leaders in AI joining us, and as we all are very aware, AI is a very hot topic, especially in the healthcare space right now. So we are really eagerly looking forward to hear from Aslam and Mr. Rashid Qureshi. So with that intro, I will hand it over to Mr. Aslam Hassan, and please take it away.
Thank you so much. Assalamu alaikum, everybody, and assalamu alaikum, Dr. Saab. That's amazing to be here. Really, last time I attended this webinar, and it was a really enlightening experience. So we're just gonna talk about the MedsightAI, but before I start, I think Sarfraz Saab gave me a really good background about me and Rashid. But let me tell you this: how I got connected with the healthcare, right? I grew up in a family where all of my sisters were becoming doctor right back home in 90s. And when they were studying and looking at the books and the bones in the house, I decided that I'm not going to pursue this career, right? So I went to the technology role. But guess what? You make a plan, and Allah has another plan. I got married again to a doctor. So So what happened is that every time at the dinner table or wherever we meet, all we talk about is medical problems, right? And they're all over the world, right? One of my sisters, she lives in UK. The other one, she lives in US, and the other one is Pakistan. And so they're all talking about the issues in the healthcare, whether in this region or that region. And that's where I got interested into what exactly, what's causing them the problems and what's going on that they're moving around. And then later down the road, I had a technology background, as you mentioned in the intro, right? But then I got my MBA done, right? And that's where I learned my business about 2 years ago. And then, me and Rashid is a very close friend of mine. We live in the same community here in US, and then we stumbled on each other. And guess what? Rashid's brother is also cardiologist, right? And we actually kind of found out that the problems in the healthcare arena is kind of same. And everybody is now looking, like my sister was telling me, I'm using this EHR and I need something that can solve my problem right away. It's too much work for me, right? Same thing coming from Rashid's brother, right, who's a cardiologist. So that's what we decided what to do, right? I mean, how we can use this AI to make doctors' life easy. So here we are. As when it comes to the agenda, this is how we're gonna flow, right? I'm just gonna talk about Gen AI, which is a generative AI in healthcare. Why, what, where, and what should be the Gen AI strategy the medical facilities or healthcare should take. And then what we are doing, how we are mapping up to what is the need in the healthcare for Gen AI, right? And what is the business value that MedsightAI can provide. And then we're gonna have a live demo, which I'm sure is gonna be a really amazing one. Hopefully you're gonna like it, right? So that's what the agenda will flow. Any housekeeping, any other issues or anything, or any questions that we have? I think we're gonna be. I'll promise. I think I'll be done between 40 to 45 minutes, and then we can, answer any questions that you have. Okay. So let's get started. Gen AI in healthcare, right? Why Gen AI in healthcare? That's required. Generative AI. So first thing is the increased pressure to do more with the less, right? That's what any healthcare official that's needed. EHR user, that's a main cause. That 78% of the physicians, especially in the US, are being using it, right? Every patient that they see, for every hour, they have to spend 2 hours on the EHR, collecting the information from the EHR, putting the notes in and whatever, right? There is an increasing demand from the acute care hospital, right? Everybody is using the EHR and they need to have a good billing, the reporting and everything. And this phenomenon is getting across the board now, right? We are seeing this in Middle East, Africa, even in Pakistan, right? I mean, everybody is now being forced to do all these things, right? And what happened is that there is so much data, it's a 50 petabyte per year that these hospitals are generating. And that comes in the clinical notes, the lab tests, the research, right? And if you really look at it, it is growing at a 29.2%, kind of rate every year, which is going to put it about third fastest growing sector. So there's too much data, but hospitals and the doctors, they're still struggling to get to the bottom of it, how to do that. One of the doctors that I was talking to, he said, a lot of times a patient comes to me and he say, you know what, I'm having this problem, and I looked at the internet and there is apparently a new drug that is out there treating it, which he didn't know. So he has to go and research and all that consumes time, right, in real time. Now, what happened is that, so that's a struggle, right? How you can access the data in a timely manner. How are you going to validate? How are you going to take that data and create actionable insights out of it? So that's going to be another challenge that, the doctors or healthcare forces, the folks are facing. And that actually caused the burnout, right? So if you really look at it, there's a shortage of nurses, there's a shortage of doctors, and doctors are leaving. And anytime the doctor leave, the healthcare organization, it's a lot of burden on them, right? Because they need to bring another doctor, replace it, and take years literally to get a new licensed doctor or whatever, right? So that's basically a lot of burden on the overall healthcare. And then the data insights are not there because, staff leaves and the new staff comes in and so on and so everything happens in that regard. So then here it is a Gen AI for healthcare, right? So if you really think about it, generative AI, it will analyze a large volume of health data. So you have a lot of data sitting there. You need to access it. So now that's a first opportunity that Gen AI can do, right? And then it will create a more efficient and accessible whole person care, right? So you have access to the data, you're going to have it on your fingertips, and that's where you will be able to provide really the efficiency to the healthcare, right? Improved experiences for even for the healthcare folks, even for the patient. And then you will be able to make a decision based on the data. And then, that's going to bring it hyper personalized care. So you're going to have an information on that particular patient as much as you can. And then what is Gen AI actually, right? So Gen AI is basically work with anything that you have, like a data, right? Text files, audio, video, images, reports. And all it does is basically take all this data. You need to run some algorithms, right? And prompt. For example, the best example is a Siri or what is called Alexa. So you tell Siri or you tell Alexa something and it provides you a new content somehow, right? By the way, my Siri got on my phone when I talked about it. So that's what it is, right? So it takes all the data, images, videos, whatever, you must be using the chat GPT, but it only works in the bounds of the data that is given to it, right? So it's not going to pick up any information that is not available to it or whatever. So that's why it has to be very hyper precise, right? Regarding that patient or regarding that reports that you're looking at it. And then it will create a new content out, right? So that's where the Gen AI comes into play. Now, if you really look at it in the healthcare organization, how they're implementing the AI. So we have done a lot of research, and by the way, these charts are everywhere, but let me walk you through it, right? So AI market in healthcare, that's, I mean, where it is heading. So in 2027, it's about 14 billion market, right, dollar. And it's growing at a 44.2%, right, on average, and every year by year, which is huge. And if you really look at it, where is the market share for AI by application? And if you look at this green piece, which is the workflow solutions, right, that's 37%. So that tells, right, where exactly people are looking to spend in the generative AI. And then comes to the natural language processing, which is basically I'm talking, I was telling you about Siri or Alexa. That's a natural language processing. So that's where the total accessible market, right, that what we have for this NLP in healthcare is about 7 billion, which is going about 27% every year. And based on the survey that IDC did for about 200 US healthcare organizations, they're saying our lead spending area is a front-end conversational AI. So I'm talking to Alexa, I'm talking to Siri, that's where my front-end conversation, the spending area is. And what exactly the two drivers for the AI implementation? So which is very much, as I mentioned earlier, improvements for the clinical processes and the clinical insights that is required for diagnosis and treatment, right? But then again, there are barriers, right? The healthcare organization are not able to do the AI implementation because they really don't know, understand the machine learning and what are the appropriate algorithms. And that is the reason there is a heavy reliance on the third parties to build algorithms, right? So 67% of these healthcare organizations say that I'm looking for somebody to come from outside and help me build this Gen AI, kind of a vision or algorithms. For the Gartner perspective, which is the top rating, of course, the research, right, company, they're saying that it's a top ranked technology in the healthcare, right? They did the survey for the executives in the healthcare area. Implemented by 92% says that we're gonna have by 2025, we're gonna have some kind of an AI implemented into our processes, right? And it's a huge projection. 53%, of the overall spending that they're doing is actually towards the application modernization, which consists of AI and so on. And the clinical voice analysis is basically on the innovation trigger, right? So right now, for next 5 to 10 years, that's where the market is heading because they need to understand how to use the voice to kind of do the AI stuff and whatnot, right? So that take all this data and I kind of say, okay, how the Gen AI that healthcare organization they can strategize this, right? So it's not only that, okay, you take the AI and you implement it, and I'm come from the technology background, right? I know that Oracle or anybody, there are so many use cases, but they really don't understand what is the problem, how are we going to solve this, right? So if you are implementing a Gen AI in your organization, it has to be very clearly articulated. What exactly the problem that you want to solve, right? Because the more precise you are, the more successful you will be with the Gen AI, right? And then define some target groups, right? So it's not only, okay, I'm gonna do it every organization or every kind of department. You need to kind of define some groups that this is the most beneficial use of the AI, right? That we would be able to use that. And then and then mark it up, right? Because you need to understand, first you define the target groups, and then you have to have a clear benefit, right? For that particular each group. It may be just adding 2 patients per day. It may be just, refine our billing processes or something. So if you are looking at the billing organization, you need to define that benefit, right? Out of what exactly you try to achieve. And then, the value add. Okay, so the data that is sitting there, if I'm going to start working in this particular kind of a domain or, in the target group, I have the access of this so much data. So what else I can do, right? What is the value add to that's coming up to this group, right? Whether we can add into it. And then the last thing is the quantifiable, right? How are you going to tie this data to some quantifiable results? And as I mentioned, okay, so you have this data. Are you increasing the healthcare kind of overall requirement for your patient? Are you basically helping your patient out that he is more happier when he comes out of your clinic? How are you going to take these results and make sure that you're making an effect to your overall healthcare system? And then, of course, the data security, ethical use, risk mitigation, they all come to this table stakes, right? I was doing the demo yesterday and people were asking me all of these type of questions, right? What's going to happen to the data and whatnot? But again, I told them very clearly, this is not a Google, right? So it's not going to go everywhere. The Gen AI only works as it's in bounds, right? So you give the data, you tell about the patient, and that Gen AI should be smart enough to detect that this data that's coming out is only about this patient, is not coming out from somebody else, and we are mixing things up. So we have to be very careful when we implementing this. And we are seeing this, right? If by any chance, by mistake, you put one patient data to another, it automatically detects it and it say, you know what, it's not relating to this page data or whatever. And then you need to think big, right? So that's where when we looked at the survey and whatnot, right? They're looking at each and every kind of area where we can implement the AI. But to begin with, they're starting with this clinical processes, right? How are we going to streamline the flow of the patients and the doctor and help them out? So that's pretty much the Gen AI story, right? And healthcare, very innovative area. I mean, everybody is looking into it, and that's what we decided that what we should do, right? How we can come in and help our family or beyond our family, the doctors, right? I mean, what we can do, and luckily, we can relate to ourselves too, because every time we, as a patient, we go to the doctors, we see what is the issue as a patient that I'm not being satisfied while I'm talking to the doctors. So then we created this one, right? So what is MedsightAI? That's basically the next agenda item. So we are actually on the mission to reduce the provider's burnout and increase the top line revenue. So we have a very specific goal that we thought about, and that's what we started with, right? We are going to be doing the EHRs, revolutionize them with the AI-powered efficiency. How are we going to do that, right? First of all, the problem, right? We articulated the problem. What is the problem and challenges for persona in healthcare? So if you look at from the nurse or the medical assistant, right? You go to the clinic and you can say that, they have very less amount of time and to input the data. They take your vitals, they take your, blood pressure, whatever, anything that is needed, and they just put it in. And it's a repetitive information, right? They get bored, they just move on, they just switch the jobs. They said, I don't like this. There's too much pressure again. I have to see like 4 patients in an hour. I have to see 3 patients, and the same information, I get bored and so on. So you need to look at that perspective. And then from the physician's perspective, you need to look at is what happened the pre and during visit, right? It's a time-consuming patient research. One doctor, one complicated patient that it needs to reset, it takes them about 15 to 20 reports to get to the crux of the problem, right? And it consumes so much of their time. It's a limited time allocation. Every doctor has a pressure that you need to see the patient within like 15 minutes or so. By the way, you need to do the research. So they can really not do any add additional patient, and that caused the delays and whatnot. And the same time, patient is not happy either because they may not have a complete research done by the time patient visits, right? And then post visit, it's not only during the visit, right? So you think about it that post visit spending additional hours and money documenting the notes, or even you need to get a scribe service, you need a transcription service. I mean, it adds on to everything, right? One of the doctor I was talking to, my cardiologist actually, he said, every time a patient comes in, I have to click 25 times minimum, right? To go from one screen to another to document everything and so on. And it said, just imagine if I'm seeing 20 patients a day, I'm doing the 500 times the click, right? And by the time I'm done, my wrist is hurting. And I'm still not done. I go home and I do the pajama time, right? Where I put the proper notes and I have to remember everything about the patient and whatnot, right? To put in the proper medication, the lab work, and all that is required by the organization. And at the end, patient is not happy, right? They need a timely insights. I mean, they just go and take a look into it and then they start researching, right? And they feel like that one doctor is not doing enough, even though they're hurting themselves and they're doing a lot, but still patient is not happy and is moving on to a new doctor and is always complaining about, this is what's going on and you're not able to diagnose my problem and whatnot. So that's all the problems are. Now, where's the solution? That's where we need to work, right? So we bring in a new era of healthcare documentation in the system. What we do. So we walk into the clinic, right? You start talking and we just start listening, right? And we're gonna take the intake and the encounter and we'll transcribe all the interaction the doctors or medical assistant having with the patient, right? It's a multilingual. You basically talk in Arabic and Urdu and Spanish or whatever the language is. We're going to convert into the notes and create the insight so you can put it automatically into the EHR, right? So no notes taking, nothing, right? How it does get done is basically the 25 clicks that you have, we're going to convert it to just 5 or 4 clicks, right? That's a magic that what we do. Then we create the AI-based insights and documentation. So once you have the transcription and everything, we pull the insights from the transcript from the conversation you have, whether it's a vitals, it's a notes, it's a prescription, lab work, whatever it is, and then we create the insights, right, the documentation for you. In medical terminology, they call it SOAP notes, right? Subjective, objective, assessment, and planning notes, right, which you can put it into the EHR. By the way, we also have an option to update automatically into EHR just by voice enable. One of the doctor I was talking to, he said, I just don't need a note taking. I also need to do something more with the voice. I just need to tell, hey, you know what? Send this prescription out, send this, the lab work out. And that's pretty much we are doing actually into our own EHR if somebody wants to go with us, right? It's a modern EHR that we have. And then the major aspect of it is the co-pilot. Co-pilot is kind of an assistant that is sitting right next to you, right? And you can ask any question you want about the patient or anything related to that, medication he's taking and the research that is going on, right? You just converse. You just need to have a conversation with it. And that's where it will provide you all the information that is out there regarding to patient. And I'll show it to you in a minute when we do the demo, right? It basically interfaces with external resources, right? Anything, for example, PubMed or any research that you have in the clinic. If you want to bring into this assistant, we have a capability to do that, right? So it's actually additional information. So imagine if you have the research on your fingertips or on your voice-based, right, kind of a note, you can grab it. Now, in a picture, how we are doing it, we are calling it a multilingual voice and AI-enabled assistant. How it works. So medical professionals, they talk to, the patient. We are listening at the back end. We are just capture the insights from the medical encounter, right? And we create the patient notes and vital prescription that I mentioned earlier, right? And then we can also talk to, if we are using our own EHR, we will be able to talk to the pharmacy, labs, insurance, and billing. If not, if you have your own EHR, it's okay. We can fetch any information that is required, right? And then the last but not least, not last actually, there's one more item. So, and then we put everything into the EHR, right? So if you have your own EHR, we work with that. If not, then we can provide the EHR. And then we can augment this with the clinical decision support, right? Or any healthcare information exchange. And now the information goes circle in circle, right? So it's going to be easier for you. So you establish a patient, you put it in the EHR, and you're able to grab any information that you want, before actually seeing the patient for the next time. Okay. The value prop. How does it help? Remember, I told you that you have to do the Gen AI, but you need to understand what's the business out there. It actually, based on the research, it actually opens up 70% of the physician's time, right? So imagine what you can do with that, the physician's time that you have. You can just have fun. You can just go for a hike maybe, or you can add, more patient. And that actually lets you increase about 50% more patient throughput. On average, a doctor see about 16 patients a day, right, in a hospital setting, which is roughly coming out to be 20 to 30 minutes, per patient per day if you have an 8 hours per day. This will reduce significantly, right? So you will be able to add additional one patient every hour, which means 50% increase in the patient throughput every day, right? And then what exactly mean? 8 patients per day per physician. And if you really look at it, that will bring in additional up to $2 million per year to a practice, right? For a single doctor, which is huge, right? And then on top of that, you will have a significant reduction in a physician's burnout. And then you have a dedicated attention to patient. Because right now, once you walk into the office, right, or clinic, doctor just start making notes and it doesn't even make any eye contact with you, right? But with this thing, everything is kind of seamless. You will just see, you just talk, and then everything will be done at the back end, right? Now, if you look at it, the competition where we are, right, with the MedsightAI, you have these 4 major components. By the way, we start with 3, but the 4th is kind of optional, right? There are so many companies who are doing this thing: voice transcription and note creations, Nuance, Abridge, Suki. You heard about them, right? But nobody has a language conversion insights. Nobody has any co-pilot or assistant sitting there to just get you the information retrieval. And of course, there is no option intelligent EMR, which is basically, the voice enabled EMR. So nobody will be able to do that, come close to what we are doing right now. It is huge. Okay, perfect. So that's where my presentation, which is right at 30 minutes, which is good. And I'm now gonna do the demo. And I think Dr. Hamid, you're gonna help me out with this thing, right? If
Sure.
you don't mind. Okay. Perfect. Let me share some screen with you first. Where is my? Let me see where it is. There you are. Sorry about that.
After everything you have done, you sounds like a pure doctor now. So I'm happy to be your patient.
All right, that's a fun part of it. I get so excited when I look at it. The way it works. Every time I show it to the doctors, I feel like I'm a doctor. Why not? I'm a doctor, right? I'm using this thing. Okay, so this is our interface. This is MedsightAI. You simply log in, and they have 2 options. It's a consultation and the co-pilot, as I mentioned, right? Let's start with the consultation. You hit 1 click. Oh, and that's the problem happens. Let me see. Why is that? Maybe I need to log in back in. Or maybe something's wrong with the Azure websites. Let me kill it. And then I tested this promise. I tested right now in a minute, and then it worked fine. And I don't know what's happening here. Nope. Something is wrong, Rashid. What's going on? Can you check, please?
No matter how we got advanced, these computer glitches and connection glitches is always there.
Exactly. But let me start with the co-pilot, okay? So maybe the consultation is not something right there. It's no, something is wrong with the code at the back end. There's some error happening. Let me log back. Sorry, just give me a second.
Sure. But it's amazing that how we are, moving forward in our health sector in terms of speeding up or helping the functionality of seeing patients. And
Yeah.
Hey, Aslam, can
Yeah.
you open up a private browser instead of using, maybe you're storing something this is not right anymore?
Okay, let me.
Dr. Sir, as you are a practitioner and you are already using many of these tools, so do you feel these types of gaps really and the value addition which is going to create a big difference? What's your opinion?
so far, what I have heard and have seen and used some of the tools, main thing is integration. Whatever the EMR you are using it, if they are good at integration, and then see the style of it. Because the Royal Colleges, they need a certain amount of paperwork which needs to be filled in for your consultation. So if this AI is helping you to fill fast, it will definitely save clinicians' time. And what we are actually looking for is more and more is how smooth transition is. There are some AI tools where they can convert your conversation into a SOAP note between counseling. It's easy, but they also, we have patients who speaks Chinese, Mandarin, so we have a trouble. So then you speak to them with different language, they convert into plain English language for you. So that's easy. But when you're talking with a couple of patients together, like a mother and a child, and that's a part where we are trying to struggle to put everything together in a proper conversation. And when you're dealing with the children, I mean, a lot of things are babbling and a lot of things are not make sense. So you have to take a history, which sometimes take a lot of time. Go ahead, Aslam.
Yeah.
Perfect. So I think there was some browser issue. So we click on start a consultation, right? And it went into this page, and you need to select a patient, but I'm going to add a new patient, right? It's a little slow, I think something wrong. So, but that's what it is. And I'm going to put my name in there. This is my family name. This is my first name. I need to select a gender, male. I need to put 02, 01, 1980. Okay. And then I create the patient. Okay, create patient. These are the list of the patient that you have. And here you go. I'm going to select myself right here, and I'm going to start consultation, right? This is the second click that I need to do. When I'm going to do this, I need to select a language, and I'm going to ask Dr. Ahmed to help me out. I'm selecting Urdu, and there you go. Start listening, hopefully. Just leave me alone. Assalamu alaikum, Dr. Saab. कैसे हैं?
Alhamdulillah.
डॉक्टर साहब, मैं रात में सो रहा था तो मेरे थोड़ा, जब मैं एकदम से मेरी आंख खुली और मुझे थोड़े पसीने आ रहे थे, और मेरे लेफ्ट में भी थोड़ा सा जो है वो दर्द हो रहा था। तो मुझे समझ नहीं आया, मैंने पानी का एक ग्लास पिया और थोड़ी देर बाद जो है आई वाज फीलिंग बेटर।
अच्छा।
तो मैंने सुबह जब मैं उठा हूँ तो मुझे थोड़ी सी हुआ कि मेरे सर में दर्द हो रही थी, तो आई थॉट कि आई शुड कम एंड जस्ट चेक इट आउट विद यू।
अच्छा, ये इससे पहले भी आपको कभी हुआ है?
जी बिल्कुल, तकरीबन 2 महीने हुए से पहले मुझे हुआ था, बट इट वाज नॉट दैट सिग्निफिकेंट। मुझे इतनी पेन नहीं थी लेफ्ट आर्म में, ऑल्दो आई वाज स्वेटिंग, बट आफ्टर अ व्हाइल आई फेल्ट बेटर।
अच्छा, आप अदरवाइज मेडिकली हेल्दी हैं? कोई आपको और कोई प्रॉब्लम तो नहीं है? कोई आप मेडिसिन तो नहीं ले रहे हैं?
नहीं, मैं मेडिसिन लेता हूँ क्योंकि आई एम अ हार्ट पेशेंट, राइट? आई मीन आई हैड अ हार्ट अटैक लाइक 20 years ago। मैं एस्पिरिन लेता हूँ 81 मिलीग्राम, और मैं प्लेविक्स भी ले रहा हूँ 75 मिलीग्राम एवरी डे।
अच्छा, तो आपने अभी आपका आखिरी ईसीजी या एक ईसीजी कब हुआ था? करवाया आपने?
जी जी, ईकेजी मेरा तकरीबन 2 साल पहले हुआ था, जब मैंने आई थिंक आपको लास्ट टाइम जब मैं आपसे मिला था, उसके बाद तो नहीं हुआ बिल्कुल भी। तो अब जो है, यू नो, मे बी देयर इज अ टाइम टू गेट इट आउट, चेक इट आउट।
बिल्कुल। तो इसके अलावा आपको और कोई सिम्टम्स हैं?
अभी तो थोड़ी सी सर में दर्द हो रही है, लेकिन फिजिकली तो मैं रेगुलरली मैं स्विमिंग भी करता हूँ, मुझे कोई ऐसा प्रॉब्लम नहीं है। थोड़ा सा मुझे मसल पेन भी होता है क्योंकि मैं प्लेविक्स ले रहा हूँ, तो शायद दैट्स अ कॉज।
अच्छा okay, so यहाँ तक ठीक है or we want to continue further?
ठीक है, that's okay. Thank you so much. So we'll do the EKG and उसके बाद देख, ठीक है? So here you go. We're gonna stop listening, and then all I need to click is the generate insights. When you are generating the insights, you can see the magic is happening at the back end. And while we are doing this, I can bring in the Copilot, and that's where my Copilot is, right? And the Copilot, I'm just gonna ask, something. I can type it now. What is the age of the patient, right?
Mhm.
So let's see what's come back. Does it know this or no? We'll see. What is the age of the patient? Because it's a very open-ended question. It's right here, right? So it calculated everything. The patient, ASLAM HASAN, was born in February 1st, giving that the current date is beyond May 1824, the last every time the provider, right? So calculate the age as follows. So it's gonna calculate everything because, uske paas sara kuch aa gaya, and it will provide you. However, if you ask him something, what is the date of birth of the patient, right?
Mhm.
It will be pretty precise. Let's say क्या कहता है date of birth, क्योंकि date of birth तो मैंने ऐसे दी थी. So the date of birth of the patient is February 1st, 1980. That's our input. Okay.
Aslam, we don't see the output which you are reading now. So can you?
Sorry,
No,
you're not saying.
Umar, we can see. No, we can see it. I think
can
maybe
see it.
your screen. We can see it. Umar,
We can-
maybe your screen is not.
Maybe.
Okay. I'm sorry if I can try to bring something else, right? Let's figure. लेकिन within that time, अब आप जो transcript ये देख रही हैं उर्दू में हुई थी, लेकिन अब आप smart transcript देखिए. So what it did is actually took it and it says identified language is Urdu, and it's actually translated each and everything. Peace be upon you. Assalamu alaikum, Dr. Saab. How are you? Right? And all that stuff. All right, EKG, आपकी medication कौन सी है? My last EKG was about 2 years. It's not even that, right? It tells you the correction, the analysis. Let's say the conversation begins with a polite greeting in Urdu, common in patient-doctor interactions. The patient describes symptoms experienced, right? Uske baad the patient mentions what past experiences, other health issues and medication, which is typical for a healthcare provider, right? The conversation and the doctor acknowledge the patient current state, the translation maintain the original content of the conversation, because we need to keep the original conversation so you can save it somewhere. So let's say something comes to you tomorrow and you're going to have a complete transcript that this is what we discussed, right? So we even save that information too. When you come to the SOAP notes, here it is. It detected which medication you're taking: aspirin, 81 milligram, Plavix, 75 milligram every day, right? And I'm taking that ongoing. The patient reports, this is what happens. I suddenly awakening up for sleep, accompanied by sweating and left arm pain, exactly what I said in Urdu, right? In the morning, the patient felt a mild headache, right? Or patient is taking 81 milligram and 75 milligram. There is no physical examination done, so that was good, right? There was no vital signs on it. So it detected that, and the patient mentioned that the EKG was done last year, right? 2 years ago. That's all good. Recommended a follow-up, so that's a plan. Recommended a follow-up EKG or echo process. All you need to do, save it, right? Once you save it, it's gonna create, I believe so. It's gonna, you just have to upload it, and it's at the bottom. You can see that today's date. Every information is out there. Now you bring in the Copilot, right? And you will say what medication the patient is taking. By the way, let me actually talk to it, right? So I open it up and say what medication the patient is taking. There you go. And you enter, and it will come back and talk to it in a minute, because it's a little bit reading the information, right? Here you go.
The patient is currently taking the following medications: 1 aspirin, dosage 81 milligrams.
It tells you everything about the patient, right? So now it has the data. It did not have a data before, but now whatever the data that you're feeding into it, it will provide you, Even if you ask, I mean, now some information is kind of in your healthcare, on your billing system or whatever, right? So you can ask, what's the CPT code for the lipid panel, for example, right? And this is basically, it's in your system somewhere, right? In the billing system, or Roy, or maybe in, you know, the brain that the AI is using, you fed that information. If it has that information, here it comes in, right? The CPT code for panel is 8061. So it can provide all that information that you need, right? You can put any language you want, you will have the same experience. Unfortunately, I cannot Arabic, I can speak Punjabi, but the same thing is gonna happen, right? It will detect it, it will transcribe it, and it will do everything, the magic at the back end, right? So that's where we are. I think I'm right at 9:42, which is, I'm hoping is pretty good, and we are open for questions. Hope this was.
This is okay. Thank you so much, Aslam and Rashid Qureshi Sahab. And this was amazing, unbelievable how technology has come forward and advanced. And I think there's so much excitement. I can see the chat is lighting up like a Christmas tree. And there's a lot of question and answers. So before we go to Q&A, we will get brief comments from our panelists. So Dr. Uzair is here, Dr. Akhtar Hamid is here, and Dr. Umar Hayat are here. So I will ask them to give brief comments, and then I will ask Dr. Uzair to go to Q&A. Thank you so much.
Dr. Akhtar, you take the lead, please.
Okay, so amazing. As I mentioned, we have worked or seen and used some of the this AI generating thing. My question to you, because you know, in this part of the world, the timing is more important. So what I've found that when you're using the Copilot, as well as this your the consultation node, it is taking some time, and how long it take to integrate all of them, because we maybe 10 minutes or 15 minutes max we can do the consultation, and we need there's a lot of parts we didn't discuss, like a past medical history, or you know, allergy history or drug history or any other illnesses and the details of it. So those things. And second thing I would like to ask along with that, is your system is integrated with the ongoing EHR or current EHR, which we are using in America and Canada, or and perhaps UK?
Rashid, I'll let you answer if you don't mind.
Sure, yeah. Assalamu alaikum, everyone. My name is Rashid Qureshi. So to answer your first question, in terms of whether it's integrated with existing EHRs, so in the demo you have seen, the AI works on the present data that is available. So if the present data is available in an existing EHR, let's say Epic or Cerner, which are the two most used EHR systems, so we can integrate with those EHR systems, provided the provider, in a sense, the hospital or the clinic of those systems gave us the authority or the authorization to integrate, or to give us the key to integrate with their subscription. So once we integrate with them, we would be able to get that data from that EHR. And once we have that data, then the Copilot experience will reason over that data from that EHR, right? So it'll start from there. And you can then ask questions about past history, allergy, and all those other types of things. And that will save the time, because you don't have to open up 10 different forms to get that information. The other thing you touched upon, and correct me if I'm wrong, like how long will it take for the integration to get it done? The integration is pretty fast, in a sense, like in terms of getting it done, because it's all in the back end. If the EHR system is hosted in the cloud, which mostly all the Epic deployments are hosted in the cloud, and as well as Cerner, all it takes is an authorization key, and we will use that authorization key to start getting the data feed from the respective EHR system. So it's going to be pretty seamless. And then we can start leveraging the data. The performance aspect, I think, in terms of what you have seen, the question and answer, and the current time it takes. So that is something you will continue to improve upon. Right now, the model that we are using is a slightly older model. We will be moving on to the latest generative AI model, and the performance is going to be significantly better, at least twice as fast as what you have seen today. So hope I answered that question. If I left anything, please let me know.
Sure, I will ask along with this another leading question from that. Like I work in hospital, I also do a private practice, and I'm using Accuro. It's another one, which is another EMR system. lately everybody is trying to do some research, either you're in the hospital or either in your clinic setup. When we add this program into your EMR system, will we be able to use this to retrieve some data or do some research based on the patient, which is either currently seen or the previous from there? Would this AI system pull some data from the patients which I have already seen a year ago or 2 years ago, and if I want to put them on, will they be helpful to us or not?
Yeah, exactly. So it all depends like what the system is. Like if you are using an existing EHR system and if they have OpenAI or not OpenAI, but Open API capability where you can interface with them, then we would be able to get the data. So interestingly enough, all the current EHR systems, they support FHIR protocol, which is the industry standard mandated by US government and adopted by most of the international countries. So if they are using FHIR-based protocol, we can exchange data or we can pull data using that FHIR protocol, provided they open up the access to that database that they have. So as I mentioned, like Epic and Cerner, they are the most prevalent of the EHR systems today. And they are also operating on FHIR protocol, and they have a mechanism that they exchange data based on authorization, that once a provider gives you that authorization, you can access that data. So we have to see, I haven't checked the specific EHR that you mentioned, but we can take a look into it and see whether it provides that access grant mechanism that I mentioned that Epic and Cerner provides. But the key point, the takeaway I would say is that most of these EHR today, they are using FHIR protocol. So what it means is that if they're using FHIR protocol, it's a standard protocol through which you can exchange the information and get that information from the respective systems. So it standardizes a lot of things. And once you have that access to that data, regardless like how long is the data is in that system, we would be able to reason over that data based on the questions that you were asking, right? So let's say that you ask a question, hey, give me or summarize the medical history of that patient. It will go and find all the relevant pieces of record from the EHR system that we have integrated with to pull that information and give it to you. So in the demo, for example, that we just talked about, right, we have our own system that we are using in the Azure, which is also a FHIR-based resource. So all the transcription, everything, we also store that in Azure EHR system that we have. The option here is that you can also take that information, and if you're using your own native EHR, you can also copy that information and take that information into your respective EHR. But we can also save it on our side, and that context will continue to build up. So the next time around you will come to the system, you can also refer to the information that is already there. But also, if you're integrating with your EHR, you will get the context, the previous information, the historic information that is there for that patient, and have a union of that you can get the full blown information.
Before I let Umar to ask question, one of the attendees, Nusrat Ali, has asked that I know this is for more SOAP kind of information, but does your AI system provide any diagnostic or differential diagnosis or probable diagnosis while you're putting all those information or not?
That's a great question. So one thing I just wanted to highlight here, like AI is a very broad field, right? The specific area that we are focusing on is generative AI. And the way generative AI works, it works from the context that is already available. So it basically purely helps in the capacity of providing assistance from the data set that is already there. So it's like, and a good example would be that for a human being, if I give that human being a book and ask that person to read that book, I can ask questions related to that book only, and the human being can provide me answers related to that book. But that human being would not become an expert of that domain. Like I cannot say that, okay, now you have read that book, tell me what could be possible, or what are the things that could be possible. That human being would not be able to tell me that. But there are fields in AI where they can observe that information and they can predict information. They can provide some analytics on top of it based on the material that they have acquired. So we are not, delving in that direction because that's a very deep area where you need to acquire a lot of domain information. You have to acquire a lot of analytics, and then you basically starts projecting and provide some insights based on that, right? And it becomes very difficult in a sense because, or very problematic in some cases, because if you provide some insights which is not accurate, then you're on the hook for that, right? So that's why we stayed away from that for now, and we are focusing on the generative AI capability, where it leverages the context that has been given, and it assists the doctor or the medical professional to provide information within that context, and help them to speed up their work in that fashion.
Thank you. Umar, over to you. You can ask and I can read some question in the meantime. Yeah, go ahead.
Thank you, Dr. Akhtar Hamid. I will suggest one thing. Since we, as participants, are the people who are passionate and regularly attend these seminars, I will encourage everybody to share their LinkedIn link in the chat session, so this way we can start connecting with each other and make a pool like where we can even afterward can collaborate on different fronts. So my question, I mean, I see most of the artificial intelligence, we talk very often about the use of it and take the advantage of the historical data. Is there any effort in this field, like where how to collect in a structured way the data, so this way the use of the artificial intelligence is not just based on the random historical data, rather feed the data fed in a more structured fashion? Any comment on that?
Yeah, so I can give you my perspective, right? And the main, I think, advancements that, at least what I have observed in the healthcare industry, is a lot more standardization on the FHIR protocol that I was talking about. So the FHIR resource essentially provides a very structured way of documenting everything and anything that is related to the patient. Like, it is such a huge, I would say, protocol that it documents everything that is related to the patient, like whether it's for the care of the patient, any information, relatives, medical history, family history, all of that. They have thought through over the years that what are all the pieces of information that is needed to really cover the all the aspects of a patient. And they define that protocol, that is structured way of capturing all that information. And all the EHR systems that are out there, they basically references that resource, that protocol, to essentially enable the experience for the doctors, for the medical professionals to then go in and provide all that information, and they'll just go and save that. Now, the challenge, the flip side of that is, it's a lot of information, and it's a lot of data that as a medical professional you have to now go and fill in, because from the compliance perspective, it becomes important that you have to have that information in there. Otherwise, it would not complete that workflow for you. And there comes in the challenge here that, okay, now there's this burnout that happens. Now you have to provide all that information for every patient that you see. So that's where the problem space that we are trying to address, like how can we simplify it and bridge that gap from the technology, the FHIR protocol, and the doctors who where their main task is to take care of the patient, right? Understand the patient and get get that context in the database so that it can be useful for the next visit and so on. So that's where we are kind of bridging that gap, to get that information from the interaction and save it in a structured manner using FHIR protocol, so that it can be useful for the subsequent iterations, and they can get the context easily and provide the care that is needed. But yeah, I mean, it took some time, right? I mean, from getting from a completely unstructured way of multiple EHR systems doing their own thing. Now, mostly all the organizations that are running today, they're using this FHIR-based protocol and is standardized on that. So it helps in structure, in presenting the information in a structured manner, but it caused this burnout as well, because now it becomes very difficult to keep up with all that information that needs to be presented all the time in a standard way. Hope I answered that that you have.
You did, and I think your software did as well. I like the way it was spitting out in a very structured manner, the data. So thank you very much.
Yeah.
I will pass on to
Yeah,
Dr. Zaid. Thank you.
Yeah, there is another. If I may ask the question, Dr. Zaid, is it okay?
Yes, yes, you
So
are the one. You can go ahead.
there is another question here on our that is this how you going to like legitimize these integration into our notes? Is it legal? Is it will be acceptable by the college? Is this any barrier to that?
Great question. So right now, all these healthcare systems that are out there, there are standards from the privacy and compliance perspective. Like HIPAA is one of the body that manages all the relevant compliance and data privacy related aspects of that system. So the components that we are using, for example, in our system, we are building on Azure healthcare systems, and Azure healthcare systems is already HIPAA compliant. The OpenAI that we are using, it's hosted on Azure private cloud. What it means is that it's not going to the OpenAI service, which is a public service. It's coming to Azure OpenAI, which is on the private Azure cloud. And for that, we are making sure that any data that we are storing on our systems is going to be stored on Azure healthcare system, which is again HIPAA compliant. And any of the the voice generation that you have seen, like text to speech and speech to text, all of that is happening locally. So none of that information is leaving and going to a private cloud, for example. So that helps us to maintain the HIPAA compliance related regulations. And we are also going through the certification process as well for our system to basically have an audit done on this whole interactions and make sure that we are not violating any of the principles there.
So yes, go ahead, Dr. Zai.
No, you take the lead. You have read all the questions.
So there's a Abir Arif. I'm putting two questions together. If you give a quick and precise, like a short answer, because we have a few questions waiting. So he's asking that there are opportunities for transcriptionists to transition into the other roles within the healthcare system, or is relation to the AI technology itself, since their work is replaced by AI. And the one also, Sajid is asking, will generative AI work on machine learning or deep learning algorithms?
Yeah, so the way, I think the first question, of course, there is going to be this transition because AI is going to replace some of the tasks that human operators they are currently doing. Their task would no longer be, or their effort is no longer would be relevant because of AI can do those things in a much more efficient manner. So just like in any evolution or a transformation that happens, people scale up and go into the next area of focus where they can be helpful and provide the needed help in some other set of field and basically level up their knowledge. In terms of whether it's deep learning or it's using machine learning, so deep learning is basically a class of machine learning. So it basically enables the information being presented and analyzed and categorized and leverage that information so that it can be made useful for the users to be able to interact with that information. So this generative AI, it's a class of AI where it is using deep learning in a sense that it can ingest large volumes of data and contextualize that information. So just like the example that I've given, like if you give a human being a book and that person reads that book, a human brain works in a way that they can contextualize that information, in a way they can categorize that information so that you can ask a question and they can immediately reference that in knowledge that they have just gained and provide a reasonable answer. So that's the output that happens with the deep learning. So this is the same process through which the generative AI currently works on. So it had been trained, the model had been trained, and once the model has trained, so it can understand how to contextualize information. So now you can give some other information, some other context. It can understand how to answer those questions based on the learning that it had already developed.
Okay. So there's an anonymous attendee who is asking, I think we know the answer. They're saying, is it kind of acting as a medical interpreter or more than that? I mean, as the invention or use of mobile phone kind of replacing the use of watch is. So I guess this is what we are seeing here, that this can also help in interpreter, because you can have different languages and you can integrate in different languages. If I'm saying the right way or not.
Yeah, so definitely, I think it is truly working as a assistant to the doctors. Like, it's not replacing doctors by any stretch of imagination, because the doctors are there to provide the care, to understand the complexity of the diagnosis and all the other things that goes in. But the generative AI, what it can do is to speed up their process. Like, so if they have a question about this patient, the history of the patient, or if they need to document all that information. So all that that exchange of data that happens, that the doctor will typically go and try to fetch that information by themselves. Generative AI in the current form, this solution helps them to speed up their work. It's not replacing them in terms of providing the diagnosis, for example. It's that's why we call it as a co-pilot, in a sense that it's helping the doctor, not taking over their work.
Thank you. I think we are stretched out of time, Sarfraz. You can maybe give some closing remarks and we'll take it from. Thank
Absolutely.
you, Rashid.
Thank you. Okay. Thank you so much, Dr. Akhtar Hamid, Dr. Saeed Uzair, and Dr. Umair Hayat for your comments as moderators. And again, thank you so much, Aslam Hussain and Rashid Qureshi Saab, for enlightening us with this amazing technology. And I'm really excited when I see all of this. I said that can improve the workflow both in the patient care space, but I was also thinking that in my work of clinical research, it can certainly help a lot. So I'll probably talk to the EMR in our institute to see if they can incorporate it. But I can see there is so much excitement from the audience, and I see that this is going to take off. So thank you again for bringing this to our attention, and we really appreciate your time and efforts, and I'm sure that this is not the last time we are talking, and we will definitely be in touch. So thank you again, and for all the audience, we'll say that please stay tuned. We will come back with another of our webinar series in 2 weeks, so stay tuned for that, and we'll see you all. Till then, please take care, and see you around.
Thank you very
so
much.
much. It was exciting to be here. Thank you.
Thank you so much.